Hi, everyone, and welcome to the first episode of the IDP Chronicles on the International Dentist podcast, where we will be speaking to fellow international dentists to understand their journey and all the things they did to enhance their profile to land an admission into a dental school in the US. For all those of you who don't know, my name is Dr. Pallak Razdan. I graduated in India from Manipal College of Dental Sciences, Mangalore in 2017, and I'm currently pursuing my DDS program at the UCSF School of Dentistry. Before we dive into our first episode, I'd like to take a minute to introduce our guest. Her name is Dr. Devyani Rana. She graduated from the People's College of Dental Sciences in Bhopal and is also currently pursuing her DDS program at the UCSF School of Dentistry. This entire podcast is filled with information about preceptorships because Devyani has done a 9-month long preceptorship at UCLA. And she also has experience, looking for preceptorships, sort of crafting her profile in order to be accepted for preceptorships. We will also walk through, are preceptorships necessary and, what are the ways in which you can enhance your profile and get some North American dental experience. So stay tuned, and without further ado, let's jump into the episode. Hi, Devyani, and welcome to IDP Chronicles, where we're going to be chatting with international dentists all throughout the US and trying to understand, what it takes to get into US dental school. We'll be busting myths, and most importantly, we'll be talking about all of our unique experiences and what brought us here. So, welcome. You're my first guest.
Thanks for
Thank
inviting
you for
me.
agreeing.
Thank you.
But honestly, when I had this idea, Devyani was one of the first people to very kindly and enthusiastically agree. So, thank you.
You're welcome.
For those of you who don't know, Devyani is my batchmate. She's also an international dentist. And what sets her vastly apart from a lot of applicants is the fact that she has a lot of experience when it comes to the US and preceptorships, which is something that everyone's always constantly asking. Do we need preceptorships? Do we not need preceptorships? And if so, how to get them? What is the right process? What is the process that Devyani followed? So I'm going to let you take it away from here. If you can please give us like a brief introduction of, um, who you are, where you're from, how you decided to move to the US, everything.
Okay, so my name is Devyani Rana, and I am from India, and I worked in India for like 4.5 years before coming to United States. And I come from a very small town in India, so the biggest challenge for me in this process was lack of exposure because I had very few people to guide me. I had just one senior who was practicing as a dentist in Jacksonville, Florida, and he guided me in this process. But rest, I had to figure everything on my own.
Like all of us.
Yeah. And one thing that kept me going was that I was very passionate to come here and become a dentist.
That is very obvious with you.
Yeah.
Your passion really sings.
So that's what kept me going, and I joined a lot of groups. And like, for example, there was a study group. It's still there. It's called International Dental Community. It was started by international dentist like us. She is doing her pediatric residency right now. Her name is Dr. Amanjot Benz, and that group was very helpful for me. Like, she guided really well, and all of us who were there in the study club, I think all of us got selected somewhere.
Oh, wow.
All of us.
Wow, that's amazing.
Yeah, and she was very encouraging and helpful. And I remember once she said to us that, each one of you is going to get selected in a dental school one day. You just have to keep going. And I was like, each one of us is going to get selected.
Yeah.
Because it seemed like a distant dream at that time.
Yeah. So, take us back. When exactly was this? What year are you talking about?
This was end of 2020.
End of 2020. Okay.
And it was the COVID was at its peak, and that was a double challenge.
Right.
That was my first year of applying, But
just before you go there, quickly, if you can tell us where you did your dentistry from in India, where did you work? What is your work experience, and why did you choose to come to the US? Why dentistry here?
So I did my BDS from People's College of Dental Sciences and Research Center in Bhopal. And after my BDS, I worked in a private clinic for 2 years. And then I was working at Apollo Hospital in Gwalior. And I worked there for like 2.5 years.
Mm-hmm.
And I was not satisfied with my work in India. I was not satisfied with the pay, to be honest. So I
thank you for mentioning that, because for some reason I feel like in our community this is not talked about enough, that back home in India, as BDS graduates, we do not get paid what we deserve. So many other professions that are neither skilled nor qualified make much more than us. So thank you for highlighting that aspect.
And then one of my, as I said, my senior was who I was very close to. He was practicing as a dentist in Jacksonville, Florida, and my brother had an education here, so I was like inspired by them to come and get my education here.
Okay.
Yeah.
That's nice. So, of course, your brother had his education here, and there was this dentist you were close to, and you were not satisfied with your work. You were not satisfied with your, how you were being compensated.
Mm-hmm.
So, definitely, all these, I think, are major factors that all of us have in common for when we decide to, make the move.
Mm-hmm.
So, can you tell us a little bit about your journey, like what all you did, and especially because I think being on a visitor visa in the US, how you were able to get that, quintessential North American experience in dentistry to enhance your profile. Also, before you start, sorry, is it a myth that we need a North American North American dentistry exposure, or do you think it's necessary that we need it in the CAPID application?
Very good question. Thank you for asking me this question. So what happened was that because I had very less exposure, and the dentist who was guiding me at his time when he had applied, at that time, clearing part 1 and part 2 was enough to get admission in a dental school. But by the time it came to me, clearing part 1, part 2 was not enough. And I did not know this. And I cleared part 1 and part 2 in my first attempt, but I did not get called from any school. I think I got a call from just one school, that was Colorado, and I could not clear the interview.
And this was which cycle?
This was 2020.
2020. So 2020 was your first cycle.
Yeah.
You just took the part 1 and part 2, and at that point of time, you were told that that was enough, right?
Yeah, but gradually, many of my friends and we all realized that it's important to have some US experience, whether it's preceptorship or it's a master's program, anything. And with these kind of programs, if you get into a preceptorship, I would say it's not enough. Even preceptorship nowadays is not enough.
That's true.
When I came here, that was just my way of stepping my foot inside America. After setting my foot here, I tried to volunteer at like 5 to 6 places. I volunteered, and in 1 year, I gained, I think, 80 to 85 hours of community service in America. And I kept going. And I went on a mission trip to Mexico. So all these things kind of added up to my experience, not just clinical from UCLA. I did a preceptorship in AEGD from UCLA. So it did not just add up to my clinical experience, but also to my exposure and how Americans work in a healthcare setting. For example, I used to volunteer at Cedars-Sinai Hospital in Los Angeles, where I learned how they work in a healthcare setting, and I could speak about that during my interviews. And the more work you do, the more passionate you look during your interviews.
Yeah, that's for sure.
Yeah.
So, can you sort of just chronologically take us through all the experience that you gained? So, you said, 80 to 85 hours of community service, and then you went on a mission trip to Mexico. You worked at the hospital in, sorry, you said Los Angeles, Siddharth Sanai, right? And you've done a preceptorship from UCLA. So, if you can just sort of walk us through chronologically, like what you did first and then what you did next, and why you felt the need to keep going and keep adding to your profile. Like what was the larger picture, what was the vision behind getting all these experiences one after the other?
So, like I said, I had applied in 2020. I did not get called from most of the schools except Colorado. And I was looking for opportunities, but due to COVID, there were not many opportunities. But I got an opportunity to do, first opportunity was my clinical rotations in Philadelphia under a prosthodontist who is a faculty at Temple University. That was a great experience. I got to learn how differently dentures are made here, and just the work environment. And then I got an opportunity to do externship in periodontology in at Oklahoma University. That was also a good experience because I had not seen so many surgeries happening in India in perio.
Right.
Because perios, I feel it's a very limited branch in India.
That's true. Yeah. Also, I think somewhere it's patient acceptance, somewhere it's lack of expertise.
Yeah.
But yeah, definitely perio, for what perio is here versus what it is back home, there's so much of a difference, right?
Yeah.
Okay, so then what did you do?
Then, as I was doing these things, I got a call from UCLA. I had applied for ACT program in UCLA. ACT is a certificate program in endodontics where you can treat patients.
Oh,
yeah.
Okay.
And it's done in restorative dentistry as well. So if anybody interested, then they can apply and they can work on patients. And till now, they are allowed to practice in Chicago if you do ACT from UCLA.
Okay.
And second call I got from UCLA for preceptorship in AEGD program. So the reason why I had to choose AEGD preceptorship was because due to COVID, the embassies were shut down. I couldn't get a student visa. So the ACT professor was not ready, like, to defer my seat.
Okay.
And the preceptorship professor was ready to defer my seat, so I was able to come after a few months for.
So one lost opportunity, but one gained opportunity as well, right? Universe has its way of working. So also, can you talk about, like, I think because this is like a very frequently asked question, is UCLA the only dental school that gives you a work permit while you're on your student visa for the preceptorship? If you can like shed some light on that as well.
Yeah, so
and also your experience at UCLA as a preceptor.
Yeah. So when you get into AEGD UCLA, you will get a hell lot of exposure because I saw perio surgeries, full mouth rehabilitations, implant surgeries, complicated endodontic surgeries, a lot of exposure, and that would help you tremendously in writing your applications as well.
Yeah.
Because they ask questions that you have to answer during your
CAPID
cycle.
Supplemental applications.
Yeah, and you will see some great cases being done in the clinic there. So, what was your question? Sorry.
No, UCLA's experience and then OPT.
Yeah. So yeah, UCLA is the only school that gives OPT for 1 year. So you can work as a assistant or you can work as a hygienist in Florida if you can move to Florida. And it is given to people who do preceptorship for 9 months or 12 months.
Okay. Yeah. So the time period has to be at a minimum of 9 to 12 months.
9 to 12.
And after you finish that preceptorship, then you get a 1 year OPT. And you said what were the two options?
You can work as a dental assistant, or you can go to Florida and work as a dental hygienist.
And you can work as a dental assistant anywhere, any state?
Yeah,
Or...
anywhere, any state.
Okay, that's...
Yeah.
Note
That's
that
up
down.
to
That's
you where
like
you get your job.
Gold, nuggets of gold. No, I know, I've done so much research on all this. When I was starting out, this is before like I had moved to Canada and I was able to get like North American experience there. None of this information, I can guarantee you, is available on the internet with like a Google search. The kind of information that we can get through our individualized experiences, a lot of these things are not available on the internet. And you know, it's a simple thing. Till the time you don't do it, you don't know it, kind of a thing, right?
Yeah.
Okay.
And
wow, I'd say I didn't know all these things. I'm sure a lot of people right now don't know it.
But if they get preceptorship in any other school too, it's a great experience, and they can look for research opportunities as well while being a preceptor. But nowadays, if you are a preceptor in UCLA, you may not get a research opportunity along with preceptorship, because I tried it, but it was not allowed. Nowadays, it's not allowed.
Mm-hmm.
Earlier, it was.
Mm-hmm.
And there are preceptorships in various departments in UCLA. So you can choose a preceptorship that focuses on research.
Nice.
But I applied for a preceptorship that focused on clinical experience.
Okay. So you got done with the preceptorship, and we will come to how exactly does one work towards getting a preceptorship, and how do you determine which is the right preceptorship for you before you spend all that money. I also want to talk about, you know, what are the finances involved in having a preceptorship? How much should one be prepared for? But before that, I want to understand after the preceptorship. So you did a preceptorship for 9 months, right? And what followed after that?
So what happened was that first you have to decide whether you want to do a preceptorship focused in research at UCLA or focused on clinical experience. In other schools, you may get a chance to do both, but not as per my experience. You can't get a chance to have both the experience in UCLA.
Right.
And what was your question? Sorry.
What followed after this preceptorship?
Okay, so you have to apply for your work visa, and then as you get your work permit, I would say even before you get your work permit, start looking for jobs. Even like when you reach the last month of your preceptorship, start looking for jobs, and there will be dentists who would ask you for work interview.
Oh,
yeah, they will.
Okay.
You will decide on a price, like they will pay you like let's say $20 per hour or something.
It's a compensated work interview.
Yeah,
you don't do it for free.
Yeah.
That is something that is most
Don't
important
do it
to note.
for free.
Don't do it for free.
Yeah. So you start giving interviews. If they like you, they will keep you. If they don't like you, and it's easy to get a job. It's not that hard. If you have done your due diligence, then
during your preceptorship,
then I think they will like you.
And I remember you telling me, like, every time we're in Fleming Lab, and Devyani's handwork is so good. Oh my God. And I think she like gives a lot of credit to the fact that you spent a lot of time in your preceptorship in the UCLA preclinical labs, practicing, you know, buying teeth and actually just cutting them one after the other. I guess what I want to ask you is, how does one make the best use of a preceptorship?
So when I started my preceptorship, I had this thing in mind that I will try my best in every way possible. So I requested my course director to let me practice in the sim lab, to get me permission to sit there and practice. And he actually not just let us have the permission to practice there, but also attend classes with the ACT students. The ACT is Advanced Clinical Training in UCLA.
This is the same course that you were talking about that you missed out on because of student visa. Okay. So you got that experience?
Yeah, so the preps that were taught to the ACT restorative class students were actually a little complicated, but it really helped because, when you attend classes with them, you understand how American students are taught here.
Right.
And there are faculty who will help you in the sim lab there. They can guide you on how you make your preps and what mistakes you are making, and you can go there and practice on the weekends, on the weekdays. It's a very good opportunity.
Amazing.
Yeah, and as far as the finances are concerned, I would like to add one more thing, that if anybody get a chance to do preceptorship at UCLA, you can also do a part-time job on campus.
Oh, wow.
UCLA is a huge university. They have 2 or 3 part-time job opportunities. For example, I worked in their art museum. They have an art museum on campus, and it's a very easy job. You just have to stand in the gallery and
guide people. Yeah.
Through the museum, and that's it. And I think you can earn enough for your own
Sustenance.
and you don't have to ask your parents for money all the time.
Right. Which is a big thing.
Yeah.
Right.
And that also gives you an exposure of, about the work culture in America, how serious they are about following rules, and you get used to it. For example, like in India, if I come 5 minutes late or 10 minutes late to work, nobody says anything. But there, they were very serious about these things.
Yeah.
So a lot of things you learn along the way.
North America really teaches you work culture, I think, and professionalism. To a way that, in a way that I don't think you can learn anywhere else. And it is so important to have all these different kinds of jobs and really understand not just dentistry, but like working outside and building that character and ability to talk to different people, understand where they come from, right?
And in CAPIT application, there is a section for, other relevant information. You can mention your part-time job information there, like you have a job experience in America other than dentistry.
Which is, I think what is very important for everybody watching this to understand is that, yes, having dental experience is one thing. It is not the only thing, right? It is important for your application to be wholesome. Like it has to be holistic. It can't just be one-dimensional because, here they look at more than that.
Yeah,
right?
they
Here
look
they
at
look at
your
more than
overall personality. And when you participate, see, American schools want students who are proactive and engaged.
Yeah.
So when they see these many experiences in your profile, they actually like it.
Yeah.
So some schools that are not research oriented and focus on clinical experience more, they like your profile, they like your clinical experience, they like your community service experience. They like the fact that you are doing something outside of dentistry as well.
Nice. So when it comes to finances, how much does a preceptorship cost? And not just at UCLA. I mean, if you can share approximate numbers, whatever is the tuition fee. Of course, living costs are, subject to personal this thing. But if you can share what the tuition fee is like, and also if you've, sort of researched while in your process, researched about other preceptorships and how much, what is the average cost that it is, per month, and then 3 months, 6 months, 9 months, if you can give us that breakdown.
I think per quarter, it depends on the department you are applying to. So, for example, in UCLA, the aesthetic department, it charges around $8,000 per quarter.
Okay. So quarter is 3 months.
Yes.
Every 3 months.
AEGD, they charge around $6,000 per quarter.
Mm-hmm.
Oklahoma was around, I think, $3,000 per.
Okay.
It was for 1 month.
Mm-hmm. Oh, 3,000 for 1 month, Oklahoma.
Yeah.
Okay.
Yeah. And anybody who's not getting an opportunity like I know preceptorships have become very competitive these days.
Very hard to get is what I'm hearing too. Yeah.
So I would recommend that apply as early as you can. Like to get into a preceptorship program that starts from March, apply in around November or something, way before it starts, or
Right.
even before that.
Right. So earlier your application goes in, the better. Okay, so these are approximate costs, right? It ranges from 3,000 a month to approximately 8,000, 9,000 for 3 months. I think I remember I was looking at Boston at some point, and I have a couple of junior, seniors, like people from my school also that have gone to Boston. And I think the average cost there is also 3,000 to 3,500, but I think that's per month. I may be wrong on this. Please look up all school websites for their most recent, cost breakdown. These numbers are what we have seen and researched during our time, but it's been some time to that time also, right? All right. So now that we have our finances,
And one more thing I would like to say, that try to save money and try to find a part-time job.
yeah,
Because you are going to get into a dental school and it's going to be very expensive. So try to spend as less money as you can and try to find a part-time job. It would be really helpful.
yeah, I agree. Yeah, because then there's also money for like application process to the DDS programs, etc., right, for CAPID. So Devyani, how does one land a preceptorship? What should you have in your profile? What can you do sitting back home in your home country at this point? If someone is looking to apply for this cycle for preceptorship, what is something that they can work on? What should they have on their application? What is the process of applying for a preceptorship? If you can share that with us, please.
Okay, so I would say even for a preceptorship, I had my TOEFL score was around 106 at that
So you
time.
need a TOEFL score
Yeah,
to
you
start
need
with,
for
an
UCLA
active.
preceptorship, you need TOEFL.
Okay. I think some other schools also require English
Uh,
proficiency.
yeah,
Yeah.
obviously, because you are talking to patients in the clinics, so you
Yeah.
have to prove that you can
Speak.
well.
Yeah.
Then I had a work experience of around 4 years, but I had other preceptors who were with me who did not have a lot of experience, but their TOEFL score was good, and some of them were giving their NPD Part 2 at that time. So it's up to you if you want to come and take NBD part.
Oh, but there's no NBD part 1, part 2 anymore. INBD. Yeah. Yeah.
If you want to take up, but I would say that if you take INBD first and then have some time to enhance your profile.
Yeah.
Do community services and all of that.
Yeah.
That's a better thing to do rather than spending a lot of time preparing for INBD, and then your preceptorship also
Take some time out of
Yeah.
your life.
Yeah.
Yeah, that's for sure.
And you said how to prepare your
Yeah.
profile. Yeah, so I had work experience, I had TOEFL above 100, and I had done a certificate course in rotary endodontics.
Nice.
Because I was not getting any opportunity and I wanted to learn rotary, so I just did a course in India back home. That also improved my skills, and somewhere it showed
Yeah.
in my application that I was doing everything I could to enhance my skills. So yeah, and as I said, I did a externship as well, because
Yeah.
that time was very tough.
Yeah.
It was COVID time, and like whatever opportunities I got, I could get. I just
So let's talk a little bit more about this externship, because I know we were growing chronologically. So we started with you coming here, working with that dentist, then getting into your preceptorship program.
no externship.
Sorry, externship, right?
Then I got a call
Then
from
you got a call
UCLA.
from UCLA. And I know you also did a trip to Mexico, a mission trip to Mexico. So did that happen after the preceptorship?
Yeah, during my preceptorship, I went with, there's a group called Flying Samaritans. It's a group of UCSD students. So you have to travel from Los Angeles to San Diego.
UCSD is San Diego, right?
San Diego.
UCSD, okay.
And the students just, you can tell them that you would like to go with them, email them. Flying Samaritans is a very famous group. They go on a mission trip every month, and it's not expensive. It's just $40.
$40 for the whole trip?
Yeah.
Wow.
And they go in groups, so you can just go in a group with them. And
how long is this mission trip?
It's every month, so you can do any amount of trips that you want. But since I did not have time, so I did one, and it was like a 2-day trip.
A 2-day trip. Okay. And what exactly do you do on this mission trip? If you can please share that with us.
We did oral screenings, we did cleanings, we did fillings, but not a very complicated procedures, just basic
dentistry. And did you have is it exactly like how we do community dentistry back in India, limited tools, limited resources?
Yeah, exactly.
Yeah.
Exactly. We had very limited resources, but it was a very good experience. Yeah.
Nice. So, okay, so then you went to Mexico during your preceptorship, and your preceptorship got over, and then I know you were working for a dentist as a dental assistant.
I worked at 2 clinics. So you can work at 2 or 3 clinics if you have time.
Right. And what was that experience like? Having your first job in North America is a big thing. Whether that's as a dental assistant, as at the Museum of Fine Arts or anywhere, having your first job in anywhere in this country is a huge achievement.
So one of the dentists that I worked for, and I would say this, that try to choose a dentist who does quality work. Like my dentist, his practice was like beyond my imagination. Like his standards were so high that I had never seen such standards before. And that's why I chose to work from him, even though I had to go commute from Los Angeles to Torrance every day. And it's a 1.5 hour commute.
And despite that.
But yeah, and dentists who do high quality work, they also pay very high, their assistants. So it was a very good experience, and he also guided me in making good cavities, good crown preps, because he had at least 6 microscopes in his clinic.
Wow.
Yeah, he was
That's
a very rich
dream, dude. That's a dream.
For the first time, I got a chance to see my cavity and crown preps under a microscope.
Yeah.
And I saw all
full zoom, you can see your axiopulpal line angles and your floor, if it's smooth or not. It's exactly 2 mm to the dentine or not.
And then, that's how my work is so good, because I got guidance from so many dentists, good dentists.
So I guess it's safe to say that your passion only grew when you realized that, there is so much more to dentistry than what we have seen back home, right? So yeah, that sounds like a great experience. Okay, so then what was your next application cycle?
So I had started applying during my preceptorship, and I got calls from 4 schools. It was UOP, UCLA, UCSF, and Colorado.
And this was your second cycle?
This was my third cycle.
Okay, so when was your second cycle? First cycle was in 2020. Yeah.
2021 was my
second cycle. And at that time, you were here.
Yeah.
You were here.
I was not here. My preceptorship started from 21st September.
Okay.
And my bench exams finished in August.
Okay. So it was very back to back.
Yeah.
Okay. So second cycle, did you have any calls?
I had a call from Nevada, UNLV. And I got a call from Loma Linda at that time.
Loma Linda. Oh, nice. Okay.
My interview went well, but at that time, my bench exam somehow was not perfect.
Okay.
My bench performance.
Yeah.
So, yeah, that's it. I in September I started my preceptorship. And also like that year only people who had student visa, only they could come to US.
Right. COVID really did a number on this whole application process on that year. Okay.
But one thing I would like to say is that never lose passion for this. Never give up. And somewhere when you try your best, universe is also helping you achieve your dream.
I agree. So, cycle 1, 1 school. Cycle 2, 2 schools. Cycle 3, 4 schools. And this was your third cycle, right?
Yeah.
Okay. So, tell us more about the 4 schools and then how you decided to go with UCSF.
So, I really felt the difference when I sat for the interviews after my preceptorship, because I had gained so much experience. I had a lot of stories to tell. Oftentimes when we are applying from India, or when we have just clinical experience, we don't have much stories to tell. So these experiences really helped me give really good interviews, perform really well during interviews. And as such, after my Colorado interview, like I realized that it's not you need a coach. I agree, you do need a coach, but these experiences are more important.
Yeah.
Because if you don't have these experiences, different experiences, then
what are you going to talk to them about, right?
Like what will the coach teach you to speak about?
And you can't share someone else's experience as your own experience. I mean, not only is that wrong, but you will never have that complete grasp of the story and what exactly happened because you weren't there, right?
Yeah. And then the interviewers also lose interest.
Yeah.
Once they see that you are not passionate enough, or it's not coming out that genuinely.
Right. Yeah, I think that's one thing to note. So you felt differences when you sat for interviews, and how did you decide on UCSF? Because our batch is the first 3-year program, whereas other schools were 2 years. So I'm sure there was a little bit of that thought process. Should I go for 2 years? Should I go for 3 years? There was a little bit of that, dilemma, because more loan, more student debt, and then also like opportunity cost, because others who join at the same time as you will graduate before you and will be earning a year before you are able to graduate. So how did you make that decision?
I always wanted to study in UCSF, and this school has a really good reputation. I mean, it's a world ranking school. Who would not want to come here?
Yeah.
And
we're top 5, I think.
Yeah.
Yeah.
And my family too, like my brother always helped me during this process, and he also wanted me to be here.
Yeah.
I mean, I had a chance to go to Colorado, but my family was here, and I always wanted to study here.
What is special about UCSF besides the ranking?
A large patient flow. Like you never have to worry about arranging a patient on your exam day. You'll always get a patient here. And one more thing I would like to say is that, before deciding that I want to study in this school or that school, I would really encourage people to go and visit schools. They conduct open houses every year, every 6 months. Try to go and visit the school. Then a lot of things would get clear in your mind.
Yeah.
That which school is suitable for you.
I remember you telling me about this one particular school about, well, they don't even have a library. Like, what is wrong with it?
Yeah,
because I was really, why didn't I get in?
Yeah, so I mean, if I'm spending so much money, then if anybody is spending so much money, they want a good ecosystem on campus.
Yeah, that is important.
They want on-campus housing, gym, because you have a life out of dental school as well. Sometimes you want to study in the library. I mean,
I live in the library. This room is where I have studied a lot.
And UCSF has great facilities here.
Yeah,
like,
that's true. I think even our student pantry, the fact that we have
Yeah, we
That
get
is
free
such a
groceries every
huge
Thursday.
plus. Yeah. Free groceries every Thursday with respect to like fresh produce, and then any time of the week, if you need any of like pantry staples, they're always available. And I think that's a great resource to have. And I know,
Like every
yeah,
school has its pros and
exactly.
cons, but I feel that I need that ecosystem around me to,
Yeah.
have a good time
Yeah.
during dental school, because I also have a life
Yeah.
out of dental
Yeah.
school. Yeah.
Absolutely. Yeah. Okay, so I think we can wrap this up. We're coming to a close. We did get some really quality information, and I know that none of this is available online. So thank you for sharing your journey with us and all your great experience with us. Do you have any last sort of, parting words, like your
I would
ending
say
wisdom?
never lose hope, and don't lose your passion. And I know this journey is very tough, but keep looking for opportunities.
Yeah.
And also try to engage yourself in different type of activities. Like for example, I volunteered at a place where they used to help people recover from drug addictions. And in India, I volunteered for the World Health Organization. So not just Red Cross and these common places, but you can volunteer at different places,
Right.
with different experiences. So you will have different stories to tell during your interview.
Yeah. And we'll discuss more on volunteering with another really fun guest of ours tomorrow. But yeah, so never give up and keep up the passion.
And never stop looking for opportunities. There are opportunities everywhere.
Yeah. Ask, right? Ask around, send
Yeah.
emails. Yeah, that's true.
And learn to write good emails. Like try to send at least 20-25 emails each day.
Yeah. At least then one person will reply, right? At least one person
Yeah.
will respond. Yeah.
But sometimes if you are lucky, many people reply and you get many opportunities.
Yeah. Well, may that luck always be with you and with you. And with me. But no, thank you so much, Devyani, for this. Thank you for being the first person to do this, and thank you for all the support you offer me sitting next to me in lab. We're actually lab partners. And thank you for sharing all this information with us.
Thank you, Pallak. Thank you, guys. All the best.